Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hi everyone, I am Dr. Preethish. I work as a consultant neurologist and clinical neurophysiologist at Neuro Foundation, Salem. So I've graduated from NIMANS and I've been working in Salem since then.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So uh, brain is made up of billions of neurons. So each nerve is like an electrical wire. So they are, interconnected electrical signals that are passing between the neurons. So when an abnormal spark or an outrage, an abnormal electrical activity happens in the brain, it represents seizure. So we know that brain is the one which controls every important aspect like thinking, movements, balance, etc. So if a outrage or a spark happens in movements, then you get violent movements of the body that we see as fix outside, and it can happen in other areas as well. Suppose it happens in the behavioral area, it can happen in memory, it can happen in balance, etc. So any abnormal electrical activity going on in the brain, we call it as a seizure.
What is epilepsy?
So when a person has a tendency to develop recurrent unprovoked seizures, so the latest ILA classification defines that the person should have at least two unprovoked seizures. Unprovoked in the sense without any reason. Suppose a person develops a seizure beyond 24 hours. Suppose I get a seizure today, and without any reason, I get another seizure after a month or so, or after 2 years, or after 1 year, then I have a tendency to develop recurrent seizures. So then that is called as an epilepsy.
What are the different types of seizures and do they affect people differently?
Yes. So seizures are of multiple types. As I said, it can affect any part of the brain function. So the most common one we know is like the one which comes with jerky movements. That's usually not missed, and people usually tend to find it out easily. But there can be different semiologies of seizures. But broadly, ILAE classifies them as generalized seizures and focal seizures. So when the whole part of the brain gets affected at once, then both parts of your body, including the head, undergoes a violent jerky movement that is called as a generalized tonic-clonic seizure. But it can be just a generalized absence seizure as well, where patient just keeps staring and the entire part of the body gets freezed. So it could be any generalized seizure where the entire part of the brain and thus the entire part of the body gets involved. The second type is called a focal seizure where a particular part of the brain gets involved. So you won't get the entire body reacting to it. It may be just head version, which means head turning towards one side. It can be just few abnormal movements happening in one part of your hand or the leg. It can be any of that sort. So if it happens in one side and then goes to the entire brain, then it is called as a focal onset seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So we generally tend to work up in detail, but even though we do that, most part of the some part of the epilepsies we don't find the exact cause. So in general, the literature says that 50% of the epilepsy cases can still be unsorted, where we don't know the real etiology. But if we do find the exact reason, it sometimes it's easy to treat because we know the cause. It can vary from a multitude of causes. For example, a simple cyst sitting in your brain can cause a seizure. A tumor sitting in the brain can cause a seizure. A fever in your brain can cause a seizure. So you treat the root cause and treat the patient, and then probably you have a 70% chance of getting out of the seizure disorder.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes. So as I said, the one which comes with violent, jerky movements, tightness of your hands and legs, they are very easy to diagnose. They are not to be missed so easily. But the one which comes bit different. For example, some seizures can come as behavioral arrest, where people just stare at you or stare at an object and they will not be responsive for some time. There can be automatisms like lip smacking. There can be hand automatisms. There can be flickering eye movements. People just freeze, stand, and then they don't have recollection of the event for 2 to 3 minutes. They can have just sudden fall. So it can be of various types, but in majority of the seizures, people will have loss of touch with surroundings. They will not be able to recall that event. So that is the major clue with which you can, identify that this could be a seizure.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, epilepsy, as we know, with recent scientific advancements, we know it is coming from the brain. But epilepsy has been part and parcel of our human tradition. Even in animals, it's been there for so many years. So when science was not advanced, people used to think that this is some kind of abnormal paranormal activity or something like that. So that has resulted in stigma which is still there in the community. So because of the stigma, starting from childhood till the even till the end of your life, people suffer a lot. Even relatives, people who are neighbors, they think that people with epilepsy should be not treated normally. In places of employment, people are being either not given jobs, or they are being seen with a different eye, which makes them depressed, and they have been even told that they should not get married. uh, they don't get a level playing field with a normal person, and this is not the scenario where most of the seizures, as I said, 70% could be treated, and they have to be treated normally. So this stigma is the major thing, and especially in many developing countries including India, which needs to be slowly educated and eradicated.
How does this stigma affect people with epilepsy?
Yes, as I said, the major thing that I often see in patients, especially from remote areas and villages, is first, treating them as a different person. Second thing, no marriage. Third, unemployment. And even in schools, these children are treated differently by teachers. They panic that these children could create havoc in schools, and something might happen, so they tell them not to you know uh, uh, admit them in their schools. So this is still continuing even in this current century. And as I said, all these things should change over time with proper awareness and educational programs.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So epilepsy as such, in the majority, will last less than 5. But the place where the epilepsy happens, that's what is the major cause of casualty. Because suppose there are hard objects, sharp objects, above a particular height or something, so they tend to fall. If they're swimming, they tend to drown. If there are sharp objects nearby, they tend to harm themselves. So people who are caregivers, when they have epilepsy patients at their home, they have to take care of certain important things where they make sure that these patients don't come across sharp objects or hard objects nearby. And if a seizure happens, just position and allow for the seizure to stop. Majority and clock it. So majority of them will stop within 5 minutes. A few might take 1 or 2 minutes extra, but if it crosses 10 minutes, it needs emergency. So an immediate ambulance has to be, called in, and then the patient seizure has to be stopped, and it is called as a status epilepticus. So these are the basic awareness or first aid and precautions that caregivers of epilepsy patients should need to know.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yes, there are certain things called triggers in patients with epilepsy because even though they are on medications, sometimes these triggers might, provoke an epilepsy. So people should be aware that lack of sleep, which is most important trigger, so which can, provoke an epilepsy. So lack of sleep, then if they miss then if they skip foods, if they skip meals, then that would be a trigger. Any kind of illness, prolonged illness like fever, affection, uh, so and so long usage of computers, mobiles, uh, theater lights, etc. All these things can trigger seizure. So these are some of the precautions that epilepsy patients should always keep in their mind.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So, as I said before, be aware that people with epilepsy should not swim. They should not. They are seizure free for at least 6 months. Then they might be. But otherwise, if they have a tendency to develop recurrent seizures, no driving, no sharp object on the house, and they should not be climbing a particular height, or they should not be working at heights. Then most important thing.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, the understanding of epilepsy is evolving. What we call it as a refractory epilepsy. So I would like to tell people with epilepsy, I would like to come forward and consult a neurologist.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.